Hi guys, my name is Mick Fanning, owner of Physio Performance here in Drogheda. First of all, thank you for taking the time to watch our video. Today we're going to talk about all things back pain. Back pain is the number one injury or complaint we deal with and hear about here in the clinic on a daily basis. Today we're going to chat about the myths about back pain, and we're going to deconstruct some of the fears and misconceptions out there about back pain. We feel this is really important to give you the confidence and the empowerment to get back living and enjoying life. One of the biggest misconceptions about back pain is that something has moved out of place in the back. Even though this seems kind of common knowledge, and you'll hear people talking about I put my back out or I slipped the disc, there's actually very little evidence out there to show that that actually happens. The back and the spine is one of the most strongest and robust structures in the body. Although the pain can be quite intense when we have back pain, it doesn't mean that something has moved or can't repair itself. Actually, when we get MRIs or x-rays of the back, we very rarely see any evidence of something out of place. And we have to remember that these scans and x-rays are one of the most sensitive bits of equipment out there. So really trusting that the back is strong and nothing is out of place is the most important starting point for your recovery. This will allow you to get back to normal movement, to engage with exercise, actually to try and kind of stress the body a little bit to make it stronger. The second biggest myth or misconception we hear about back pain is that you're destined for surgery if you've had multiple episodes of back pain. This isn't always the case. Actually, only a very tiny percentage of people with back pain end up going for surgery. People who are educated on what caused their back pain, understanding triggers that influence it, but also putting in a plan to help their body feel the best, actually have a far better outcome than most people who resort to surgery. There is no evidence in the short term, medium term, or long term that surgery can put you in a better position. In saying that, back pain surgery is sometimes needed. There is people who have exhausted all of their options and have gone back surgery and made a pretty decent, if not a good recovery. What then people will have done is they will have put in a lot of kind of pre-surgery work and post-surgery kind of rehab and exercise to give themselves the best chance. So to summarize, what we're saying is that we never should rush for surgery with back pain. The body has tremendous ability to recover, especially the back. It's just about sometimes getting the right help and advice to guide you through that. The third biggest misconception or myth that we hear about back pain is that bending, lifting, twisting is bad for the back and should be totally avoided. This may seem strange, but that's not the answer to helping your back get better. Avoiding activities like that will probably in the long term probably keep your back pain there and probably train your body to be weak and train your body to be protective of itself. Obviously, sometimes we can't hurt our back when we go to lift and bend something up, so it's natural to think that's the real catalyst in why our back pain came on. It can be in some cases, but what we tend to see is there's a lot more factors going on at the time of your back pain, and probably to help yourself get better, we probably actually need to be bending, lifting and twisting the back to help its capacity be better, be stronger. So when you do go into them movements and activities, it's so used to it that it won't react with a flare-up. The next misconception or myth that we hear about back pain is that I need an MRI to understand or solve my back pain. And yeah, we can totally understand this. It's difficult when you've had pain for a long time and it's not getting better with all the treatments, medication and everything that you've tried to help it. So the next logical option seems, yeah, let's get an MRI. But what we tend to see with an MRI is that they tend to show a lot of anticipated age-related changes. What we mean by that is we can sometimes MRI people who are in pain and MRI people who aren't in pain, and their scans can show the exact same findings. So what we have to establish from that is that pain is not always linked to the pictures on an x-ray or an MRI. Also, MRIs, they don't show your ability to recover. They don't show your mood, your energy levels, your sleep strategies. So there's so much more involved in back pain than looking at an MRI, because ultimately an MRI will show anticipated age-related changes. So we have wrinkles on the outside, We also have wrinkles on the inside, so we're going to see minor disc bulges, we're going to see disc degeneration, we're going to see wear and tear. But what you have to remember is everybody has them. So what we actually use an MRI for is actually to give you the confidence to move and use your back. So when we get an MRI back, we probably very rarely see anything out of place, anything slipped, all them myths that we talked about in phase 1 of this video. So it actually gives us a license to actually move and use the area, and that's sometimes where an MRI can be really helpful. It will rule out anything sinister or dangerous as well. We see that only in a very small percentage of the population. Sometimes we want to flip the MRI results around in our favor, not look at all the negative kind of complicated words that may imply weakness or doom and gloom, to actually the opposite. Anything sinister or dangerous ruled out. Yeah, the back looks pretty normal for someone of your age. So again, let's get it moving, let's get it strong. The fifth and final kind of myth and misconception that we deal with on a daily basis is that sitting or my posture is the cause of my back pain, that bad posture is why I have back pain. Again, it's not as straightforward as this. What we tend to see is, sitting in one position too long could definitely be a catalyst for pain, and as a general rule, we should be moving often. Your best position is your next position, but there's little evidence to show that if someone has upright posture or slouch posture, both can have back pain, and so it's not as straightforward as that. So to help that, what we want to do is be moving often and have that tissue kind of as strong as we can. So when it does have to sit or be in a sitting or even a standing position for a while, that has the capacity and the tolerance to do that. So don't get bogged down on your posture, get more concentrated on moving and helping the area feel strong.